Hello, I'm Dr. Crystal Garcia for Contemporary Pediatrics. Today I'll be talking about sun protection in children with Dr. Stephen R. Feldman, who holds a triple appointment as a professor of dermatology, pathology, and public health sciences, and is the director of the Center for Dermatology Research at Wake Forest Baptist Health. Dr. Feldman, you've recently participated in a study that evaluated how frequently U.S. physicians mention sunscreen during patient visits. The results showed that sunscreen discussions on the whole are rare, and that children and adolescents receive the least amount of counseling on a per-visit basis. Why do you think this group, who is arguably the most to gain from sun protection, is being overlooked?
It's a great question. One of the things I think people have to be very careful about is talking about the motivations of other people. You know, I see this in the news all the time where Republicans tell us that the Democrats are bad because they believe something, and vice versa. And as a dermatologist, I don't want to speak too, I don't want to claim that I'm an authority on why pediatricians do what they do. But you could imagine a number of reasons. The problems with sun exposure generally occur later in life when people are no longer in the pediatrician's office. So they may not see skin cancers as often as dermatologists. Certainly, they're not seeing skin cancers as often as dermatologists do, and so it may not be top of mind for them. They may have plenty of other bigger fish to fry. I don't know if smoking and obesity are bigger issues for them than how much sun people get. For some people, it matters more than others. With people who are fair as you. I would hope your pediatrician, might mention sun protection to you and your kids, should you have any. And it may matter a little bit where you live. Hopefully, in Florida, where there's a lot more sun, people may, think about this a little bit more.
What are the professional society recommendations in terms of pediatric counseling for sun protective behaviors?
I'm not sure that the U.S. Task Force on Preventive Services has come out and said that we should be protecting our kids with sunscreen on a regular basis. I think some things are just logical and reasonable. That that when the kids are outdoors at school, it would be a good thing for them to be wearing a hat, especially if they've got fair skin and are out in the middle of the day between 10 and 2. I know from personal experiences here in North Carolina that the schools actively discourage people from wearing hats, I think because they're worried about gang violence and stuff. But it would be sensible. In Australia, they've made it part of the society's culture to protect yourself more from the sun, and they've made great headway at reducing the number of skin cancers. Here in the United States, we're pretty far behind in that. Now, most skin cancers, you could, basal cells and squamous cells, you can just cut them off, so, it's not like leukemia. On the other hand, melanomas do kill people, but they're much less common. But taking some sensible steps to protect oneself from getting burned, I think would be very reasonable.
You had mentioned a little bit about how, maybe skin cancer isn't top of mind for pediatricians. Well, they have, so many things that they have to counsel about, and different safety topics. So how would you suggest that maybe they can work that into their communication and counseling of patients?
I think we're all going to be on an electronic medical record before long, and if it's a standard part of the counseling that's automatically inserted into the EMR post-visit printout that people get, I think that would be a very efficient way to do it. If you really want to do something, I think there's nothing better than the interpersonal, caring, hand on the shoulder from a doctor telling the person, what the doctor thinks is in their best interest. And, a lot of kids with, dark complexions like mine, it may not be, that critical, but if someone comes from Irish, Scottish background and on, has super fair skin, blue eyes, wears a blue sweater to match, those kind of folks, they wearing protective gear or using sunscreen regularly would be very appropriate to tell folks.
One of the things that parents might push back on is the risk of maybe vitamin D deficiency. How would you address a concern like that?
That's a great question. So if somebody has dark skin, they're probably at greater risk of vitamin D deficiency, and they may not need nearly so much sun protection. If they've got fair skin, it's going to be hard to protect themselves well enough from the sun to not get enough vitamin D. But if there was any question about it, you could do what dermatologists do and take a vitamin D pill every day.
In adolescence, you wouldn't see this in children as much, but in adolescence, you might have them wanting to tan, get ready, looking good for prom. What would you suggest in that kind of situation?
Well, one of the key things about tanning beds is that they can be addictive. I mean, the reason they're growing so fast isn't just a cultural norm for looking dark. It's that there's a feel-good effect, and some people get addicted to it. And I think it's important not, I don't know, some dermatologists think we ought to ban them entirely. I think we would do well to at least educate people about the potential risks of the tanning beds. If somebody wants to look dark for an event, a spray-on tan will work just as well. Even better would be to recognize the fact that folks like Julianne Moore and Nicole Kidman are incredibly attractive, and that this idea that you have to be dark to be beautiful just really doesn't make any sense.
Well, thank you, Dr. Feldman, for joining me today. This has been Dr. Crystal Garcia for Contemporary Pediatrics.